Ovarian cysts, ovarian cyst. They can be troublesome at times, not just because they cause you pain, but also because certain types of ovarian cysts can affect your fertility. Do you want to know all about ovarian cysts and what you can do to prevent them affecting your fertility? Keep watching. Hi, I'm Dr. Kady. This is Heydoc. Welcome to this channel where we talk about all things to do with women's health, fertility medicine, and pregnancy-related matters. If you like this type of content, do consider hitting the subscribe button. For those of you who are new, welcome, and for our returning subscribers, thank you for your love. Why don't we start by describing what ovarian cysts are? Ovarian cysts are fluid-filled sacs that occur on or inside the ovary. They are so common, and more often than not, they are harmless. But in some cases, they can affect your fertility and your overall reproductive health. These cysts can vary in size, so they can range from being quite small, almost microscopic, to being several centimeters wide. And earlier, I described ovarian cysts as fluid-filled sacs. But let's get a little bit more complicated for those of you who have stuck with the video so far. Yes, ovarian cysts are very often fluid-filled, but those ovarian cysts are known as simple ovarian cysts, where they just contain a little bit of fluid, often clear type of fluid, and these type of ovarian cysts very often resolve by themselves. However, you can have another type of ovarian cyst which can contain air. Sometimes it may contain blood, but at times certain ovarian cysts may contain semi-solid material. So there are two different groups of ovarian cysts. The first group is known as the functional cysts. These are the types of cysts that are very common and they're simple and harmless. Within this group, the type of cysts that exists include the follicular cysts. So we have the follicular cysts, and these type of cysts form when the egg that they contain do not get released during ovulation. These type of cysts will usually disappear by the end of that cycle. Then we have the corpus luteum cyst. Now, this is physiological. This is actually supposed to be there, and it's the remnant of the follicle that has just burst to release the egg. This corpus luteum will stick around in the first few days after ovulation has happened, and the purpose of the corpus luteum is to be able to support the fertilized egg that will soon be implanting, and then after it disappears. So we've talked about physiological cysts that happen in every menstrual cycle for those who are ovulating regularly. Let's look at the second group. And these are the pathological cysts. These ones do not occur in every woman. So unlike the first group, most women will have these physiological cysts. These pathological cysts, if you have them, there is a problem. So they tend to be less common and are the ones that are going to affect your fertility and very often can be painful. Within this group, we have the endometriomas, also known as the chocolate cysts, and these are caused by endometriosis. And endometriomas can damage the ovarian tissue, as well as affecting not only the number of eggs that are remaining within the ovary, but also the quality of eggs that are produced within that ovary. Then there are the cysts that are seen in women who have polycystic ovarian syndrome. With this type of pathological cyst, there are multiple, numerous, very little but immature cysts that are found in each ovary of the woman who has PCOS. This is linked to hormonal imbalance, and there is a strong correlation between having these multiple immature cysts within your ovaries and suffering from infertility. And the final type within this group are the dermoid and cystadenomas. These cysts, though they are non-cancerous, these cysts can often become quite large, and if left unattended and not monitored, they do have the potential of becoming cancerous. They are of particular worry when they are found in younger women, so in women in their reproductive years, because these women have many years ahead of them, and at any stage these dermoid cysts can change. And so there is a greater tendency for us to want to remove these dermoid cysts when they occur in younger women. So the moral of the story, ladies, is that if your doctor tells you that you have got an ovarian cyst, you need to be asking immediately, which one do I have? Is it a functional cyst or is it a pathological cyst? What are we going to do about it? Don't just leave it and say, oh, I have an ovarian cyst and that's it. No. If it's a pathological cyst, you need to make a plan with your doctor as to how you will go about monitoring those cysts to make sure that they do not change or work together to ensure that they do not go on to affect your fertility if you're not ready to have a child immediately at the time of being given the diagnosis. Many ovarian cysts do not cause any symptoms, and that's particularly true for the functional cyst. But if they are large or of the pathological cyst group, they are more than likely to cause you the following symptoms. The first is pelvic pain, and the type of pain that you experience with ovarian cysts tend to be sharp, stabbing type of pain, and it's going to be one-sided simply because it's going to cause you pain on the ovary where the cyst is at, and you know that you have two ovaries, so if you have the pain on the right side, it's likely to be on the right, and vice versa. Also, women describe a sensation of being bloated and full in their pelvic area, particularly when the cyst is quite large and it's been lingering for a long period of time. For women with PCOS, what they may also be experiencing is the irregular periods, and that is part and parcel of PCOS because of the hormonal imbalance. But when these women with the PCOS type of cysts finally do get their period tends to be quite heavy because the endometrial lining has been building up for several months. If you have an ovarian cyst that is quite large and naturally is occupying quite a big space in your pelvic area, when you become sexually intimate, that is going to cause you pain because the ovarian cyst that is either within the ovary or on the ovary is being pushed and pulled, and that is going to cause disruption of the local structures, and that is going to lead to pain. So deep-sighted pain during sexual intercourse is also a common symptom of ovarian cyst, particularly when they are large. Again, another symptom that tends to happen when the cyst is large is frequent urination. So this happens because the large ovarian cyst is then pressing on the bladder, causing you to want to go to the toilet all the time. So sometimes frequent urination is not an automatic sign that you have a urinary tract infection. That's why you need to avoid going to your doctor when you have urine frequency to say, oh, I need some antibiotic, I have a UTI. You need to give the doctor the history and let the doctor make the diagnosis his or herself. Because by going to the doctor and just saying, oh, I have a UTI, you might actually be delaying your diagnosis. If your doctor is not inquisitive, if your doctor does not probe and ask questions, you will go from consultation to consultation and will have had multiple prescriptions for antibiotics when the underlying problem, which is a large ovarian cyst, will continue to be overlooked. Now, before I move on from talking about symptoms of ovarian cyst, a absolute red flag that all women that have ovaries in their reproductive years should be aware of is sudden onset of very severe sharp stabbing pain on the one side of their pelvis. Yes, that could be an ectopic pregnancy, but that is not the topic for this video, and therefore this type of pain could be related to a large ovarian cyst. Now, That usually means that the ovarian cyst is twisted on itself and ruptured. That in and of itself is not a problem as long as the ovarian cyst is on top of the ovary. Now, just to be a little bit more complicated, what can happen, that large ovarian cyst that is sitting on top of the ovary, or when that large ovarian cyst is deeply sited within the ovary itself, can cause the ovary to twist and turn on itself. And when that happens, you start to experience severe pain, unremitting pain. And what can follow are other vague symptoms like nausea and vomiting. If you know that you have a history of ovarian cyst, whether you've been told the size of them before or not, and you get that sudden onset of pain like that, you need to be taking yourself to the hospital. Why? Because as the ovary twists on itself, the blood flow supply to the ovary is compromised. And if there is a delay, you may actually lose that ovary. So you must seek urgent medical assistance if you experience this type of pain. So how do doctors diagnose whether or not you have an ovarian cyst? Because it's all well and good having those symptoms, but those symptoms can be related to other gynecological issues. Well, the main way that ovarian cysts are diagnosed is through doing an ultrasound. It gives us several so the ultrasound gives us lots of information, like the type of ovarian cyst that we're dealing with, their size, and of course the location. Once we find out the type of ovarian cyst that we are dealing with, if it has been reported that you have got a pathological ovarian cyst, or some doctors may use the term complex ovarian cyst, your doctor would be an amazing doctor if he or she was to request a CA125. CA125, it is a tumor marker that tells us whether the ovarian cyst that has just been found has got some cancerous tendencies. And if your CA125 comes back and it's normal, it is more reassuring that the complex ovarian cyst or the pathological ovarian cyst that has been found is non-cancerous. One little side note about the CA125, it's a tumor marker. They are not great and they're not specific in telling you, yes, we are definitely dealing with a cancer, but it gives us guidance. If your CA125 result comes back as positive, we are going to be more intentional, particularly with our time frame. So we're going to want you to be seen by the gynecologist sooner rather than later, a sample to be taken from that cyst and taken to the lab to make sure that cancer is ruled out. So that's a very important one for you ladies out there who get told that you have got a pathological cyst. The next thing that your doctor should be doing is requesting a CA125. For our ladies who have PCOS or have had suspected case of PCOS, if you've done an ultrasound and it's confirmed that you've got multiple follicles on both ovaries, then that's it. That's essentially the diagnosis. The best way to diagnose PCOS is via the means of an ultrasound. So if you've done an ultrasound and it's confirmed that way, you really don't need to do any other blood tests to confirm that you have PCOS. So if you have PCOS, you also do not need to do a CA125 because it's clear for you that it's not going to be a dermoid cyst or cystadenoma. So you do not need to do a CA125 or any other blood test for that matter. Particularly when you're on the budget, trust me, listen to this video. If you have PCOS on the ultrasound, you can stop there and go to your doctor, and at that stage you can start discussing the next move, which for you will be the way for you to treat your PCOS. But ladies, if you are a lady who's suffering from irregular period and you've gone straight for an ultrasound and the ultrasound has not identified the fact that you have PCOS, that's when it's worth going backwards and then getting blood tests done to find out any other reason why you might be having irregular periods or very heavy periods. And one of those blood tests that should be included is a thyroid function test. There are going to be three main treatment options. For you ladies out there who have ovarian cysts but are not actively trying to fall pregnant, so your fertility is not an issue, you don't want a baby right now, you just want to know how to keep your symptoms under control. The first option is to simply do nothing and to adopt the watch and wait approach. And that's particularly for women who don't get any symptoms. Why would you do anything further if it's not causing you problems and it has been confirmed that they are simple cysts? They are functional cysts, so you simply do nothing. That may not be such a good approach for women who are actively getting symptoms from these ovarian cysts or when the ovarian cysts are large. Again, here we're just talking about functional cysts, okay? Also known as simple cyst. So the second treatment option is to consider birth control. This treatment option is best for women who suffer from large ovarian cysts, particularly when they are recurrent. And at this stage, we're still talking about functional simple cysts, okay? Functional being fluid filled, they're not complex, they don't contain any odd material, they are just simple cysts. But they are large and reoccur and cause you significant symptoms to the point where they affect your quality of life and what we call activity of daily living. So that means that when you get a flare-up of your ovarian cyst, you can't go to work for several days, you can't look after your family for several days. For these women, putting them on birth control has been known to be effective. Now, there are different types of birth control, but the most effective one against ovarian cysts are the combined oral contraceptive pills. Combined oral contraceptive pills are ideal because they prevent ovulation, and because they prevent ovulation, they therefore prevent the resultant functional cysts that happen after ovulation has occurred. Or remember, some of the simple cysts are the follicular cysts, which form when the follicle did not release the egg. So if you are preventing ovulation altogether, you're not getting these type of cysts form altogether. The third option that there is to surgically remove the cysts through a keyhole, which is through a laparoscopy or laparotomy, and that is going to be for very large, big, complex cysts. So this option is for when the cyst is large and it doesn't resorb, it doesn't burst by itself, it persists. It causes the woman significant pain. This can also be for simple cysts, but that are large and causing symptoms, okay? So we may have to remove those surgically, particularly when they're not budging, they're not shifting, they're not getting smaller, they keep growing in size. We will have to remove them surgically. The surgical option is the only option for complex cysts, like dermoid cysts or cystadenomas, mainly because you do not want to give it a chance or risk the fact that they may change and eventually lead to ovarian cancer. So we have to remove these surgically, and when they're very big, then it's through a laparotomy, and that is when a surgical incision is made, the pelvic cavity is open, and then the cyst removed. Now, for our ladies watching this video who are actively trying to conceive but have been told that they have got ovarian cyst, do ovarian cysts affect your fertility? Not when it comes to functional or simple cysts. These cysts are natural, they're a natural part of your menstrual cycle, and they disappear and get reabsorbed by themselves. You don't need to remove those, obviously. However, endometriomas and PCOS-related cysts do lead to infertility. These type of cysts affect fertility because they interfere with ovulation. In the case of PCOS, there is a hormonal imbalance that leads to anovulation cycles. So that's menstrual cycles where the woman does not ovulate. And so, of course, that's going to affect your fertility. If you're not releasing an egg to be able to meet with the sperm, you're not going to be able to fall pregnant. With endometrioma, as previously mentioned, it affects fertility because it damages the ovarian tissue itself. And so that's going to have a negative impact on your ovarian reserve. So the millions and millions of follicles that are found in the ovary, some of which would have gone on to rupture and release a mature egg, these are all going to be damaged by the endometrial tissue that is found in the ovary where it's not supposed to be. And so endometriomas will significantly affect your ovarian reserve and prevent even ovulation from happening. So let's talk a little bit more about endometrioma and how this type of cyst can be treated so that you can go on to conceive. So the first way would be to try to manage it with a non-surgical approach. So we have the progesterone only type contraceptions, and whether it comes in the form of oral contraceptive pills or the injection or the intrauterine devices. The purpose of having the release of progesterone is that it reduces the flow of the period whilst shrinking the size of the endometrial tissues, ultimately reducing the endometrioma. The second way is to use the gonadotropin releasing hormone agonists. These will temporarily induce menopause by reducing the amount of estrogen, and this helps to effectively reduce the endometrioma. But the problem with it is that it can trigger hot flushes, it can cause bone loss. So literally all that you would have experienced if you were actually going through the menopause is what you will endure with gonadotropin releasing hormone agonists. But thankfully, the time for which you will need to be on this medication is short term. Then there are aromatase inhibitors like letrozole, and this significantly reduces your estrogen level and will also reduce the size of the endometrioma. This method is used in very severe cases, often when all of the other treatments that I mentioned previously have failed. Now, if these pharmacological options have failed, the only option that we are left with to deal with the endometrium is the surgical option. Now, remember, this option is used when, number one, pharmacological methods have failed, as I mentioned, but also number two, if the endometrioma is quite large. That being said, this surgical method that I'm about to mention now is the only way to deal with the other type of complex cyst, which are the dermoid cyst or the sister adenomas. The first kind of surgical procedure that we consider when it comes to these type of cysts is the keyhole way, the laparoscopic way. It is minimally invasive, there's a quicker recovery time, it helps the woman with pain, and particularly for those of you ladies who are trying to actively conceive, it helps with fertility. And removing these kind of cysts laparoscopically is ideal because it doesn't interfere with too many structures in your reproductive system. For you ladies looking to conceive, the dermoid cyst and the sister adenomas are problematic if you are trying for a baby, simply because they may become cancerous. So if you are looking to have a baby, yeah, the other one may not have a dermoid cyst or sister adenoma, but it's ideal to remove these complex cysts because whilst you're pregnant, because you have released an egg from the other ovary that is not affected, the dermoid cyst that you have not removed and that is still there, remember, has the potential of becoming cancerous. So imagine whilst you are pregnant, you then find out that you've got a cancer, an actively growing cancer. That will be traumatic to say the least. So before you fall pregnant, if you've been told that you've got this type of cyst, it is best to get it removed. So having said all of that, the answer to the question is yes. Many women who have been diagnosed with ovarian cyst conceive naturally. They conceive just fine without any problems. However, if the cyst is complex or otherwise known as a pathological cyst, it can affect your fertility, and it is best to deal with that type of cyst, particularly if it's a large endometrioma or a dermoid cyst or a cysta adenoma. It is best to deal with these type of cysts before falling pregnant, because they can become problematic during pregnancy, but they themselves may stop you, may prevent you from falling pregnant in the first place. That's it. I hope it's been helpful. As always, do remember to subscribe, smash the like button, share our content so that more women can come into this helpful knowledge that could ease their journey to trying to fall pregnant and increase their knowledge about their women's health. We are so grateful to our returning subscribers, particularly those of you who have followed us over the years and have showed us support and sent such encouraging messages. Thank you so much. We're so very humbled. Continue to do so, and in the meantime, check out some of the other content that we have here on Heydoc. And as always, remember that Jesus Christ is Lord and that He loves you, and He died on the cross to redeem you to the Father. Just before I leave you, a quick reminder that the Lord loves you and that Jesus Christ is our Lord and our King. And I'm going to share John 3:16, which says, "For God so loved the world that He gave His only begotten Son, so that whomever believes in Him will not perish but would have everlasting life." We will see you in our next video, and as always,